I mean, funding is definitely something that all states have to look into because we're all in a state of emergency. State economies were shut down, and how are you going to fund all of this kind of new services that you're having to basically put out there at the drop of the hat? So our state was very collaborative. Medicaid is under an umbrella agency. So, so I actually work for the Department of Health and Human Resources. So the public health is a sister bureau to Medicaid. So we were already collaborating on several initiatives before this, but after this, it really kind of increased that collaboration because, of course, they were getting a lot of CDC grants. We got the FMAP. How are we going to basically work together to make sure we're spending all our funds, honestly, drawing down as much federal match as possible in order for us to get all of these services out there into the state. So one of the things that we did was we have a COVID call, and initially it was 7 days a week. Now it has slowed down a little bit, it's 6 days a week. But basically we're on a call with all of our sister agencies. Every morning, everybody reports out exactly what's going on, where the monies are going, what we're doing, not only with funds, but all the different initiatives that are going on with the emergency.
The biggest reason or the biggest usage, I think, for the money has been on the support for our facilities as it relates to PPE, any type of other things that they needed to have. The CARES funding most certainly is heavily used right now for additional testing capabilities. We've had, unfortunately, several outbreaks in our facilities, both on our patients as well as our staff. So we have been challenged with having to quarantine people within a brick and mortar scenario. So that has been challenging. So it's just being able to hire additional nurses, the money's been used more for that than it has been used for true technology, in my opinion. The only exception probably being the item that Glen mentioned, which is the acquisition of our telehealth solution.
We have not used very much state money, so much of our changes were supported federally. Everything from like buying all the hardware that we needed to move people to telework, to paying for the development hours that we needed to make all these policy changes, and then some of the direct supports to people. So cash payments, childcare payments, all of that was funded either through CRF or through an increase in a block grant. So we have spent a fair amount of that money. The state as a whole has reserved some of that money, hoping that it will roll over. But as we come closer to the end of December, it's unclear if that will happen. And so, we have plans to try to utilize more money if we have the opportunity to.